Veronika Gold, a Czech Republic native, made the Bay Area her home in 2003. She has been interested in the exploration of consciousness and the healing potential of psychedelics since her teenage years. She has an expertise in the treatment of trauma, and she works with clients on preparation for and integration of psychedelic experiences, as well as personal growth and relationship issues. She is the co-founder of Polaris Insight Center, providing ketamine-assisted psychotherapy, CAP, as well as training for CAP therapists. She is also sub-investigator, therapist, and supervisor on the MAPS MDMA-assisted therapy trials for the treatment of PTSD. Veronika has also served as a consultant and facilitator in EMDR and organic intelligence trainings. Well, joining us today is Veronika Gold from Polaris Insight Center. Welcome, Veronika.
Hi, I'm delighted to be here.
Thank you so much for sharing your time with us today. We're big fans of Polaris Insight Center and excited to share more about your work with our community. I would love to jump in and get to ask you some questions about it. So you are the co-founder of Polaris, which provides ketamine-assisted psychotherapy. And you are also a sub-investigator, a therapist, and a supervisor on the MDMA-assisted therapy trials for the treatment of PTSD. So some wonderful experience in both ketamine-assisted therapy and MDMA-assisted therapy. I'm wondering, given that background, why did you start Polaris Insight Center?
Yeah, thank you. So, my journey started a long time ago before I started working for MAPS and had lifelong interest in working with non-ordinary states of consciousness and possibility of healing. And in 2016, I entered the MAPS training and started to work on the phase 2 study then. And ketamine was one of the medicines that is legally available. And I had colleagues who were working with ketamine. And so I started working at an infusion clinic. And I've learned so much, seeing patients working with that medicine, but as well, I saw the limits of working in that setting. And so talked together with my colleagues at MAPS, and we decided to start Polaris Insight Center. So 5 of us together started planning the clinic in 2017 and started in 2018 and have been growing since then. And now we have many more therapists who've joined us and as well have developed a training program.
That is so exciting and wonderful that you brought your experience from some of the most cutting edge work happening in psychedelics at the time to say, oh, I think we can do this a little differently, and to open your own space and your own opportunity to offer services and train the next generation of practitioners, which I think brings me to our question around the training program that Polaris offers for practitioners to learn ketamine-assisted psychotherapy. It's one of the most well-known ones, at least to me. And so I would love to learn more if you could tell us about how the program works. What is that like for folks?
Great. Yeah, I'll be happy to share about it. And, I just like to start a little bit kind of going back to, when we talked about starting the clinic. So there are different paradigms of working with ketamine. And so many people know mostly about the studies that have been done for using ketamine for treatment of depression, treatment-resistant depression. And a lot of those studies come from the IV world, from using ketamine in the IV setting. And the focus there is really on symptom reduction. So that is kind of what they are measuring. And then, ketamine is used in that psychological paradigm where it is used to lubricate the psychotherapy, where it loosens the boundaries, loosens kind of the internal structures, and people have more access to the material that they need to bring in and work through. And then we have that psychedelic or transpersonal paradigm where the healing happens through the transpersonal, through the psychedelic experience. And then, we could say there is as well shamanic paradigm where the guide or the therapist would be as well working together with that transpersonal place in the process. And so at Polaris, we're working, kind of those 3 to 4 models combined together. So we are, of course, getting the benefit to the clients from the neurobiochemical effect of the ketamine. We are providing psychotherapy, so we are focusing on processing the underlying material, but we as well see the transpersonal psychedelic states as crucial for healing. And so it is really a combination of these paradigms. And the goal is to help people not only experience symptom reduction, but to have better quality of life, to help them address the underlying issues. And and sometimes that's the journey, just looking at things that happen in their life. Sometimes it's go deeper to transgenerational traumas and further. So we're kind of expanding the way how we think about consciousness and how the way to healing looks like. And so that is how as well our training program is focused on. So we provide kind of a general overview of the different ways how people work with ketamine. We do think it is helpful for anyone who wants to work with ketamine to take at least some parts of the training program, because we introduce the different topics, different strategies of treatment. But as well, we think if you work in with IV, or you're working in that medical model or even psychological model, and you're using lower doses of ketamine, there are times when people will have psychedelic experiences. And so it's really helpful for the providers to know what that is about and what can come up, and how to work with that when it does. And so the training program kind of organically developed. It wasn't our plan to have a training program. We started offering trainings for really the primary therapists of our clients, kind of helping them understand what the clients are going through and how we can work together to support the treatment process. And then we were providing training for the students at CPTR, at CIIS, as one of the elective ketamine programs. And kind of from there, the program developed. And so right now it's quite extensive. We have 10 training modules, where the first 5 are kind of the introduction or intermediate ketamine-assisted psychotherapy webinars. And then we have more advanced modules, 6 and 7, which go into more complex and in-depth case consultations, case presentations. And then we have a module on working with the self of the therapist, because we see how different it is to be a therapist working with non-ordinary states compared to the traditional talk therapy. And so we are highlighting how the therapist can take care of themselves when doing this work, and how to help them process the material they might absorb or kind of carry from the sessions. So that's module 8, and I think it's kind of module 0, and very excited that people are taking that. And then there is a medical module for medical providers, but as well a lot of therapists come there. And then we have a module on creating playlists for ketamine-assisted psychotherapy. And in addition, we have as well experiential training, where people are learning to work with the medicine. And we as well provide consultation groups. And, so all of these steps are kind of part of becoming the ketamine-assisted psychotherapist. And we are thinking about it as, journey, that it's not any 1 or 2 or 10 webinars that somebody will take and is ready to be a ketamine or a psychedelic assisted therapist. That is really a journey of becoming and continuous learning. And that, there is something that people can learn by themselves, reading books, that there are things that people can learn by watching webinars and presentations. But there it's important to have, kind of an interactive training and then practice. So as well, the module 5 is a practice module where people practice with each other without a medicine, really learning the principles of ketamine-assisted psychotherapy in the way that we are working with the non-ordinary states. And then, once you finish the training and as well, you have your own experience with the medicine, that it's so important to continue with consultation. And, even after maybe in a peer consultation, that it's kind of this continuing development.
That's amazing. Wow, thank you for sharing more. I know we have lots of folks interested in exactly this kind of CAP training, and so it's great to hear more about the structure. I think you touched on this already, but I want to just offer if there's more you'd like to share around it. It's okay if not. But how the program helps practitioners become really ready to use CAP. So you mentioned there, some experiential elements. There's some practice elements. How do you help folks really absorb the learning, and are there any kind of special experiences or techniques that you lean on?
Yeah. So, when we were creating the training, because there are, great trainings that already exist and that people, might have taken. So we were as well thinking about like, what are the things and ways that we missed in our trainings, like what we wished we would have learned more about. And so we kind of structured the modules in that way, so that, we are bringing a lot of different topics. And one is, the kind of greater perspective that applies to ketamine psychotherapy, but as well all psychedelic assisted therapies, really looking at the historical and perspective and indigenous roots of the way of working with non-ordinary states of consciousness, and really learning and honoring those. And then we're bringing, working somatically, working with touch, focusing on discussing transference and countertransference, talk about different integration challenges, not just how integration looks, but what are the struggles that we can encounter, and working with trauma, working with addictions, and kind of diving into the different topics of transpersonal psychology. And throughout the training, we do breakout groups where people kind of process with each other some of the material that we are presenting on. We always answer questions. So there is kind of a chat on the side where people can ask questions as we are doing the presentation, and there are Q&A sessions. And then we have little practice sessions. So we have practice sessions that go to the preparation, that go for integration, that people have experience of working with music that we use in the session. So in module 2, there is like an hour and a half experiential where we'll guide them through a session where they kind of engage into going inward, using eye shades, having the music, and then have an integration group without medicine. But even with that, it's a quite different experience, and they're kind of learning how we are introducing people in the beginning of the session, kind of setting the ritual or the ceremony of the session. And then in module 5, that's the practice session, and we used to call it a role play module, but we are asking people to work with something what's real for them. So it's not really a role play. And people practice with each other in triads, kind of full sessions. And then as well, we go through questions that come up in sessions, so kind of engaging with each other about different possible responses and solutions to situations. And then as well, we model role play. So there is a lot of different, interactive and engaging training. And, the interesting thing about this module 5 is that oftentimes people feel very anxious about doing that, going into this practice play. But in the end of the day, people say that's, their favorite module. So, we love doing that. And then, there is the experiential retreat. And so, interestingly, it is a controversial topic in the field for different reasons. How can people legally have an experience? And, what if people don't want to have an experience with the medicine? And, we think, yes, you can work with the medicine without the experience, but it really brings a different layer if the therapist has an experience with the medicine they're working with. And I was just reading a chapter of Kate Harrison recently, and she talks about how, practitioners who had experience with ayahuasca and then were therapists for the patient, almost like that they brought that spirit of ayahuasca into the session as well, that there is this shared experience that was supporting the psychotherapy, which wasn't possible if the practitioner didn't have that experience. And so it is really the same with ketamine, and as well the ketamine space can be so varied. So in the and maybe we'll talk a little bit more about the experiential retreat later, but that is another part that truly helps people to learn how to work with the medicine and see other people working with that. And then in inspiring and inviting people to engage in the consultation with us or with other groups that are offering that. But we really think all those pieces are important in the path of the development of a ketamine therapist.
Wow. Yeah. I hear how much thought that you all have put into really making this, an experience that's really fruitful for the therapist and helps prepare them, but also gives them a window into what the client would be experiencing so that they have that connection and that grounding. I would love to hear a little more about the experiential training retreat. You touched on it and how it's a big topic of conversation in the field. Could you tell us more about it, what it's like, and how it contributes to the training and the therapeutic experience that you're hoping to build in the field?
Yeah. So we are providing the retreats in a collaboration with Rainfall Medicine, which is a clinic in Portland. So it's a collaboration of Polaris and Rainfall, and it is a 5-day, 4.5 day experiential retreat. And the thought about it is that we want the practitioner to learn through their own experience, starting to create a relationship with the medicine they're going to be working with, and as well, have the possibility to see a lot of different sessions, because people respond to ketamine very differently. So it's not the same. Like if you take a Xanax, most people will respond similarly to that medicine. But when you take a psychedelic medicine, or ketamine, even though it's not traditional psychedelic, there is just a huge variety of responses that people have and huge variety of experiences. And so when people come to the retreat, they will experience 2 sessions. So each will have one session with a sublingual lozenge ketamine and one session with the intramuscular ketamine as a client, and then as well as a sitter or as a therapist. So people pair up. Each person works with 2 different people over the week, and they switch roles. So when they're in the role of the therapist, they are supporting their client, but they're as well in the same time seeing, the other people in the group. And then in the shared integration, people hear about each other's journeys. And so, most of the retreats have about 20 to 24 participants. And so when people come out of the retreat, they have heard and witnessed about 40 different ketamine experiences. So that really can bring them more confidence in starting to work with clients. And how we hold the retreats is that we as well want to introduce different kinds of preparation and integration that we think is so crucial in creating the setting and creating the space for integration of the material. And so some of it is talking, there are intention groups, there are intakes and processing in diet, and in the group there are inquiry groups, which is kind of like a free flow of thought sharing with each other, but as well we bring in art therapy, movement, yoga, meditation, sound journey. So there is a variety of activities that we are doing together. And we're as well teaching different somatic techniques that people can do in the sessions and with the clients. We're talking in detail about the consent process and helping people stay with the process throughout the week and go deeper with their material, so that there is the opportunity of experiencing the medicine, working as a therapist, and then we come in and we as well help the trainees in their sessions with the client. So we might kind of enter into the session and work with them, and then they learn about the different integration preparation techniques, and then we do a little bit of teaching. So the teaching comes more from the material that arises from questions that arise in the retreat setting. And so we ask people to take at least module 1 of the Polaris training before they come to the retreat. It seems like if people take more of the modules, it can be more helpful. But for some people, they take module 1 and then they continue with the other modules after the experiential. So we want them to get to know us before, understand the approach, and then be able to focus on their journey of learning with the medicine over that week. And it has been really wonderful. We have planned these before the pandemic, and we had to cancel our first one, which we planned in Hawaii in 2020. And we just restarted them last year, and we've done a couple in Portland, and we've done one in the Bay Area, and we're offering them about 3 or 4 times a year. So it's something that is a deep process as well for us to hold, and it's really beautiful to see how people have really taken that experience into their practices and into their communities, and being able to have more trust and understanding of working with the medicine, because it's something that it's hard to learn just from from the webinars or from talking about it or even watching videos. So it's this kind of felt sense of the experience and trust of working with the medicine that then they can bring to their teams and their clinics.
That's so powerful. I can definitely hear how that is such a strong complement to the rigorous training you're offering in the full program, to have this experiential component where you get to really be both the person who's being cared for and also sitting with and holding space for others. That sounds like it would really give someone a great grounding into what the full range of experience is like with this medicine.
Yeah, it's as well beautiful for building community. That I think the community in psychedelic work is so important, because it's a new field, and there are some people who are in areas where there is more people and more clinics who are working with the field, but then there are places around the country where they might be the only person providing this type of work. And so these retreats as well have the kind of potential for people really creating alliances, and we've seen that people kind of continue to meet after they create peer consultation groups, peer support groups, and starting clinics. And for us, that's what has been really the most important in doing this work, was the community that we had from our team, but as well the other clinics that we were fortunate to know in the Bay Area, that there's just been so much collaboration and support, and that's really crucial and beautiful.
That's so powerful. I know at Psychedelic Support Network, that is the community aspect is one of the first things that many people are looking for when they come to the site, whether as a practitioner or as a client. Folks are looking to connect with one another. And one of the really exciting parts about ketamine is that it is legal across North America. It's accessible, at least in terms of the legality aspect. And it's really effective for treatment for conditions that haven't had a lot of innovation in treatment in the last few decades. And so I, as someone who is situated at the intersection of both CAP therapy and also has knowledge of MDMA-assisted therapy, I wonder if you would share a little bit with us about what you're looking forward to, what you're excited about as more medicines like MDMA start to roll out and maybe take up more accessibility, similar to what CAP has going on right now.
Yeah, we are living in such an exciting time with so much change and potential. And my orientation has been working with trauma and helping people with PTSD. And so being able to work on the MAPS MDMA-assisted psychotherapy trials have been just so beautiful and life-changing, and being able to offer help to those who have been so much other different treatments and maybe haven't been able to resolve some parts of the trauma. And so I'm looking forward to this therapy being available, and I imagine that there will be combinations, that in the future people might be working with maybe MDMA and ketamine after each other, or maybe even together, possibly with other medicines. And so that there will be more possibilities for people for healing. Of course, it's not suitable for everybody. And I think that it's really important to stay connected to our values as we are doing the work, why we are doing this, and increasing our training, getting help, getting community, and like I've learned so much how much this work requires of us and how much self-care we need to be able to do it well. And so I see that there is this exciting possibility, and as well that there are these things we need to be thinking about. And I'm excited about the possibility of providing this treatment in retreat settings. So in a similar way how we're providing the training, that when MDMA can be provided in a time when the person can maybe take few days off before and after to have even more time to be with what is unfolding, that they can have the structure from outside to hold them, to be able to kind of go deeper into the process. So that there is a lot of possibilities that I see that can happen. And as well, the MDMA psycho-assisted therapy is provided with co-therapy pairs, which is something that's not, so common, but it's really, really beautiful to be able to work with another clinician. And, it has been a great gift for me, and I've been so grateful for the co-therapists I have worked with. And I think we were able to provide more to the participants in the study than we would have been able to provide just by ourselves. And so I'm as well looking forward to this model of having, co-therapy teams providing the MDMA therapy, and being able to see what are the goals for the treatment that the client will be coming in with, and create treatment plans that maybe there will be more medicines that they will be working with. And sometimes it will be with the same practitioner, or sometimes it will be with multiple practitioners, and that there will be this kind of collaboration and care and support that will be provided for clients.
That's really incredible. Yeah, I'm very grateful that Polaris Insight Center, you're bringing all of this knowledge that you've already gained and prepared and practiced through the CAP program, and you're so well positioned to bring that into training for new medicines as they become available to practitioners like MDMA, which I think is just exciting to see that there's pathways developing for folks who want to work with these medicines to bring healing, to get the training they need in order to feel really confident doing that, and to have the community, like you said, which is such a powerful thing. I love the idea of the therapy co-pairs, and how that can be another community building tool also, where people are working together around supporting an individual so that they get the best care possible. It's really exciting. I want to show the link to the website, because I know that we'll have a lot of people interested in learning more about the work at Polaris Insight Center. I wonder, is there a good way for people to learn more about the program and maybe joining it?
Yeah, please visit the website, and all the information is there. We have a newsletter that people can sign up for. And, as well, feel free to email to any of us at Polaris, and we'll be happy to answer any questions or provide consultation or support.
Oh, wonderful. And we'll make sure we link to all the relevant links to the trainings and the experiential retreat in the blog, and also below this video, depending on where folks are watching it. So we'll have all that for people too. Well, thank you so much for sharing your time today, Veronika. This was really inspiring, and we're very grateful.
Thank you so much for having me.